As a healthcare provider, I've dedicated my career to helping patients prevent, manage, and recover from heart disease. But over the years, I've discovered that sometimes the very medications meant to heal can quietly become part of the problem. One common pill, widely prescribed and often overlooked, had unforeseen consequences for many of my patients battling heart trouble. NSAIDs, non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen, naproxen, and even some prescription-strength versions, are often taken without a second thought. Marketed for everything from joint pain to menstrual cramps, NSAIDs are household staples. But here's what many don't realize. Regular use of these medications can significantly increase cardiovascular risk. I've seen it time and again. Patients coming in with worsening blood pressure, fluid retention, or even signs of heart failure exacerbation. At first, their heart meds were blamed, then lifestyle factors. But after digging deeper, a pattern emerged. Daily NSAID use. How NSAIDs affect the heart. While NSAIDs work wonders in reducing inflammation and pain, they also interfere with prostaglandins, chemicals that help regulate blood flow and protect the lining of blood vessels. This interference can lead to increased blood pressure, fluid retention and swelling, higher risk of blood clots, greater likelihood of heart attacks or strokes, especially in those with existing heart disease. In fact, the FDA has issued warnings about this class of drugs, especially for people with a history of heart issues. Still, many patients either don't know about the risk or don't consider over-the-counter drugs as serious medication. Real patient stories. One of my long-term patients, a 67-year-old with controlled hypertension and mild heart failure, began experiencing sudden weight gain and shortness of breath. Lab work and cardiac testing didn't show a major change, but when I asked about recent medication use, he admitted to taking ibuprofen daily for a knee injury. Within a week of stopping the NSAID and adjusting his treatment, his symptoms improved dramatically. Another case involved a woman recovering from a heart attack. She started taking naproxen for back pain and returned a month later with dangerously high blood pressure. Again, an innocent-seeming pill was to blame. Rethinking pain management for heart patients. This doesn't mean NSAIDs should be eliminated entirely, but we need to use them judiciously, especially in individuals with cardiovascular risk factors. Alternatives like acetaminophen, Tylenol, for mild pain, though it has its own liver-related risks if overused. Physical therapy and exercise to manage chronic musculoskeletal issues. Topical pain relievers that don't affect the heart as systemic NSAIDs do. Mind-body therapies, like acupuncture or yoga, which have shown promise in reducing chronic pain. More importantly, open conversations between doctors and patients about every medication they're taking, prescription or not, are crucial. As clinicians and patients, we must be vigilant. Not every pill is benign, and even those that come without a prescription can have serious implications. NSAIDs are effective and valuable tools, but in heart patients, they must be used with care. If you or a loved one has heart disease and regularly takes NSAIDs, it's worth having a conversation with your doctor. Sometimes the most unexpected part of your treatment plan might just be the piece that's doing more harm than good.